It's time now for the Business Spotlight here on News Talk 94.7 and 970 WMAY at SIU Center for Family Medicine. And today we're talking with Dr. Solmaz Bauk, a family and community medicine class of 2018 resident. And there is an issue that seems to be popping up a lot more in the news of bed bugs. What are bed bugs?
Hi, bed bugs are small bugs that can be found anywhere that we sleep, any place that people are resting, such as hotel rooms or bedrooms or beds. They're little bugs. They do not fly. Sometimes you may not even know you have them in your house because they hide during the day.
What do they look like? How would we know when we see one?
So I wouldn't be able to know just by looking at your skin if a bed bug bit you. The best way to know is if you actually see the bug. You could kind of grab it, put it in a jar if you feel comfortable doing that, or just taking a picture in and bringing it in for your provider to look at.
And they bite?
They do bite you, yes. Sometimes you may not feel the bite as it happens because you may be resting. You may not even know that it happened until the next morning or 2 to 3 days after when the area starts to get a little itchy.
If I notice a bite on my skin, how do I identify that it might be a bed bug as opposed to maybe a mosquito bite or something else?
So there's no definitive test to tell you if it is a bed bug that bit you. The best way to know is just to have your skin evaluated.
Where should people look for bed bugs if they want to make sure that they don't have them?
So the best place or the most common place that they occur is in the bedroom. So checking your mattress, checking under the sheets, under the mattress, because like I said, they like to hide during the day. So you may not see them crawling around.
We'll talk a little more about this and find out what you can do if you're bitten and whether or not you should go to the doctor. That's all coming up here on the Business Spotlight on News Talk 94.7 and 970 WMAY.
Providing high-quality care, innovative education and research, and community services in 66 counties. SIU Medicine serves 2.2 million people in central and southern Illinois. Services include 5 community health centers through SIU's Center for Family Medicine. SIU Medicine offers state-of-the-art education, patient care, and research in a warm, caring environment. SIU Medicine. Forward for you. Visit siumed.org or call 585-8000.
Back now on the Business Spotlight on News Talk 94.7 and 970 WMAY at SIU Center for Family Medicine. And we're talking today with Dr. Solmaz Bauk, Family and Community Medicine Class of 2018 resident. And we're talking about bed bugs, something you hear about in the news and something that, that can, when it happens, it seems like it is just all-encompassing and can take over a person's house. Is that?
Yes, that's very true. And generally, they like to bite you in places that are exposed. Your skin is exposed. So if you sleep in shorts or T-shirts, it's usually the arms or the legs that are bitten. And the best thing to do when that happens is try not to scratch the areas. You can use some over-the-counter lotions or creams to help with the itching, but it just really takes time for that to go away.
Is it something that I should be concerned about and should see a doctor?
You don't necessarily have to see a doctor unless you're having some complications from the bites itself, meaning if the area gets more red, gets tender, gets inflamed, if you start having any drainage, those could be signs of a skin infection, which would need to be treated.
And I know you're not an exterminator, but if we find them in our homes, what's the next step?
The next step is to really clean up the house. You should vacuum the area. If you need to vacuum your mattress, you could do that. Wash all your bedding, your clothes in the washer, and dry them in the dryer on the highest setting that your dryer will allow. If you still continue to have problems, there are pest control options. Companies that can come out to the house use chemicals or heat treatments. If you do live in apartment buildings, probably the best person to contact would be your landlord in regards to those resources.
They seem pernicious. They seem like they're just they're hard to get rid of. If I find that I have bed bugs or start getting bit, is there anything I can do to prevent them biting me while I'm still trying to clean things up?
The best thing is to get rid of them. Number one is to get rid of them, and then if they're not there, they won't be biting you. So just hygiene, keep the house clean, and if that's not working, pest control is the next option. And if you're having any difficulty getting pest control with a landlord, we do have medical legal aids here at our clinic. That is a good resource that we could help establish you with.
Well, that's good to know, and that's good information. If you want to learn a little more, you can go to siumed.edu. That's a great resource for more information about services they offer here at SIU. Dr. Bauk, thank you very much for your time. Appreciate you being here. We are at SIU Center for Family and Community Medicine, and you can go to siumed.edu for more information on the Business Spotlight here on News Talk 94.7 and 970 WMAY.